Hi again, Dr. George Ibrahim. We again wanted to thank you for joining us today, and we're really excited to conduct this interview with you.
Oh, it's a pleasure.
Today's guest interviewer is Dr. George Ibrahim. Dr. George Ibrahim is a pediatric neurosurgeon at the Hospital for Sick Children in Toronto, Canada. He is assistant professor at the University of Toronto, and his clinical and research expertise includes surgical treatment of drug-resistant epilepsy.
So before we begin the interview, Tufatul and I just wanted to introduce ourselves. So my name is Sana Latif, and I'm an undergrad student at Wayne State University studying neuroscience with a double minor in biological sciences and political science.
My name is Tufatul Tasnim, and I'm an upcoming junior at Wayne State University. I'm also studying neuroscience with a minor in biological sciences.
Wonderful, wonderful. Pleasure to meet you both.
Very nice
to meet you too. So easing into the interview, we were wondering if you could tell us about the rationale for epilepsy surgery.
Of course. So epilepsy surgery certainly goes back a long time. This is not something that's new, but there's been some very dramatic improvements and refinements of epilepsy surgery over the last few years. Epilepsy surgery has started a long time ago at the Montreal Neurologic Institute. And the rationale for it really relates to the challenges that we have in treating epilepsy. So first of all, we know that epilepsy is a very, very common condition. So at least 1 in 100 in the world have epilepsy. And in children, that number is probably higher. And we know that medications as a first line of treatment is very good. About 2/3 of people with epilepsy have good response. That is, their seizures are well controlled on medications. But that means that 1/3 of patients also will continue to have seizures despite being on very good medications for long periods of time, often multiple medications for long periods of time. The challenge is, we know that multiple uncontrolled seizures are associated with higher risk of death. They're associated with a lot of medical complications, hospitalizations, injury, and very difficult ability to maintain employment, to feel socially connected. So we know that epilepsy has a very debilitating effect on patients. So that 1/3 group that doesn't respond to medications can often have very good outcomes if they are appropriately selected for epilepsy surgery. And epilepsy surgery has many different variations. If you know, for instance, that there's one part of the brain that's causing the seizures, you can remove that part of the brain. If that part of the brain is quite extensive or large, you might want to disconnect it from other parts of the brain. Or we now have some very good tools to apply different forms of electrical stimulation to change that circuitry so that the brain is less excitable and it seizes less. And there's been a lot of very good advancements in all of those techniques that we have for epilepsy surgery, but the rationale really comes down to the fact that epilepsy is so debilitating and that medications alone are not enough for a very large proportion of patients that could then be treated effectively with surgery.
Thank you so much for that insight. Would you please tell us a little bit of the role of clinical neurophysiologists in epilepsy surgery?
Of course. So epilepsy surgery is, despite common misconceptions, really not done by the surgeon. It is done by a team. And you really need to have a very efficient, highly specialized team with very effective communication amongst all the team members to do epilepsy surgery. And this team involves multiple really key players that are instrumental to allowing patients to then proceed on to epilepsy surgery. So there's, of course, the surgeon, who most people associate with epilepsy surgery, but really the people that put in just as much, if not more, work into each evaluation for epilepsy surgery are the neurologists, and they are the doctors, of course, who evaluate patients with epilepsy and attempt different medications before referring to surgical consideration. There are the neurophysiologists who interpret the brain waves and the electroencephalograms that we do, which is one of the cornerstones for planning for epilepsy surgery. There's radiologists, and you need very, very specialized and experienced neuroradiologists to help determine the surgical plan. There's neuropsychologists who evaluate these patients very carefully from the domain of neuropsychology to look at relative strengths and relative weaknesses that the patients have, which tell us about potentially where the seizures are arising from and what the effects of seizures are on the brain, but also what the effects of our treatments are on these patients. And of course, there's other important team members like social workers, hospital administrators. I mean, this is really a very, very large team. And every patient who is undergoing consideration for epilepsy surgery is assessed by this very large team. At the Hospital for Sick Kids, for Sick Children at Sick Kids in Toronto, this is a team that's composed of about 20 to 30 people, and all of us offer an opinion on every child that is presented for consideration for epilepsy surgery. So the neurophysiologists are a subset of this team, and they're a very important subset. They interpret all of the neurophysiology, so all of our studies of the function of the brain and the dysfunction that's caused by seizures, and they present it in a way that is contextualized in the planning of the epilepsy surgery. So they present it in a way that allows us to determine, one, whether the patient is a candidate for epilepsy surgery, and two, what the surgery that we would do can or should look like based on their understanding of the brain function and the actual characterization of the seizures, so the brain dysfunction, on the neurophysiological test, predominantly the EEG.
Wow, it's amazing how such a large team assembles and works together just for one patient, and there's so much deliberation and communication going into that one patient. So I wanted to bring attention to your recently highlighted paper, moviEEG, an animation toolbox for visualization of intracranial electroencephalography synchronization dynamics. So 7 authors were involved in this paper, and the first author is Dr. Simeon Wong. Would you please tell us about the team effort in preparing a manuscript submitted to our journal?
Of course. So the number of authors and the contributions of the authors really reflects that team that I was talking about, because many people contributed to this manuscript and many people contributed to creating the research question and presenting it and ultimately publishing it in the journal. So Simeon Wong is actually an engineer. So that's a whole other element, because I mentioned the clinical team and how instrumental the clinical team is in assessing every patient who undergoes consideration for epilepsy surgery. But there's actually a whole group of individuals that are supporting this team, like engineers, scientists, researchers, all of whom are maybe not assessing patients individually, but they play a very critical role in advancing the field of epilepsy surgery. So Simeon Wong is a brilliant digital signal processing engineer who has a very strong interest in analyzing intracranial recordings, analyzing the brainwaves from children undergoing epilepsy surgery, and trying to develop better ways for us to do epilepsy surgery, ways that are safer and ways that are more effective. And that was really the goal of this paper, as we'll talk about, I'm sure. The other members of the team, the co-authors on this paper, included neurophysiologists like Dr. Ochi and Dr. Otsubo, who are very experienced here at Sick Kids at reading and interpreting neurophysiological studies, predominantly electroencephalograms, so reading brainwaves in the form of electricity, and reading brainwaves in the form of magnetic waves, which is a different tool called magnetoencephalography, MEG. And they are really experts in this field, as well as neurosurgeons, Dr. Rutka, neurologist, Dr. Snead, and Dr. Doesburg, who is actually a clinical neuroscientist on the paper as well.
Based off of your work, we can clearly see that you're very passionate about neurosurgery. What made you choose that field specifically?
Oh my gosh, that is a wonderful, wonderful question. I think that neurosurgery in general is a wonderful, wonderful field of medicine. In many ways, it's a very small field of medicine, but once you go into it, it's actually a very, very broad field. I think that as a neurosurgeon, I really have the privilege of meeting amazing children and families that have been through their own journeys and have been through unbelievable experiences. And it really is an honor and privilege for me to meet them and to obviously work with a larger team and to do my best to help them reach their greater potential, help them go a step further along that journey, and in many cases, thankfully, treat them and cure their seizures and other conditions that they have. I think that there's very few careers that are as rewarding as neurosurgery in terms of your ability to have an impact on patients and their families. It really is a great privilege to be a part of it. And also the other thing that attracted me to neurosurgery was the opportunities not just to impact families and patients, but also to do some very, very important research that gives us greater insights into the function and dysfunction of the human brain. Compared to other fields in medicine and in the sciences, there's so much that we don't know about the brain. And every year, it astounds me the leaps and bounds of knowledge that we gain in our understanding of the human brain and how we can leverage that knowledge to treat conditions that are currently or were previously untreatable. So I'm personally both a clinician and a scientist here in Toronto. And in addition to taking care of children and their families, one of the things that I absolutely love about my job is the ability to do research and the ability to gain better insights of the human brain to treat not only today's patients, but also the patients of the future. I will add one other thing to say that neurosurgery is an absolutely wonderful community. And within this community, we have some fantastic colleagues. I mentioned the teamwork and how the teamwork is really, really critical for epilepsy surgery. We have an international network of amazing colleagues in neurosurgery. We have colleagues in nursing that we work very closely with, colleagues in physiotherapy and occupational therapy. It really is a team mentality in our field, and it's such a thrill every day to come and work with such amazing people that just inspire you and push you to do better for every patient.
Thank you so much for that. Sana, do you have another?
Oh yeah, I did actually have a question, and I wanted to thank you so much for, letting us know more about your personal experience as a clinical neurosurgeon and just the community that goes into it and the impact that it has. So you and your team have conducted groundbreaking research in clinical neurosurgery. Can you describe how your research has impacted patients with drug-resistant epilepsy?
Of course. So, research is also a team sport, so to speak, and many discoveries in research are incremental rather than transformational. And let me explain what that means. Often we make small discoveries that build on top of each other to slowly lead to better care for patients. It's unusual. I mean, it's wonderful when it happens, but it's quite rare to make a discovery that is transformational, that absolutely changes what we do overnight. And that's okay. Part of the journey of science and part of the excitement of science is seeing small incremental discoveries that lead to slow and incremental changes in our ability to care for patients. And there's many examples of that here at Sick Kids and around the world. It's not my personal area of research, but you can see the new drug discoveries that are being made. You can look at the discoveries of novel biomarkers for surgeries that are being made. That's some of my interests, and as well as others. So all of those are incremental changes that have made a huge impact when you look back 5 or 10 years over time. The other issue that I'm very interested in, and this is a focus of my research as well as others, collaborators and colleagues around the world, is the idea of personalized medicine. We have all of these tools at our disposal, and it's almost becoming like we have so many options, and it's an abundance of options to treat one patient. And what we are working towards in my research lab, certainly within our hospital, and I believe there's been a trend towards this approach worldwide, is to not only develop novel treatments, novel tools, new drugs, new surgical procedures, but to deliver the existing treatments that we have in a more intelligent way, so that we deliver the treatments that are already at our disposal to the right patient at the right time. And this idea of personalized medicine integrates multiple different domains of the neurosciences, of engineering, of mathematics, of machine learning, and we can put those all together to deliver the best treatments to patients today while we continue to develop new treatments that don't exist today for the future. So this is a video from our paper. And what we're looking at here is the connectivity between different brain regions as the brain transitions into seizure. Now, we can look at the brain waves in many different ways, but usually when we interpret brain waves, we look at just focal activity. We look at the brain waves in one particular area of the brain. What we're seeing now is the brain network, and each of these boxes above and below look at the brain network in a different frequency. But what we're looking at here is really the interaction between multiple different brain regions that are recruited into the seizure, and how the interactions between those different brain regions changes as the brain shifts from the pre-ictal, or the state before the seizures, into the ictal, which is the state during the seizures. And here we see that in certain frequencies, there's a burst of connectivity, and this is the synchronization of seizures. Seizures involve rhythmic firing of large populations of nerves, and we see that in this video. But we also see that in certain frequencies, the part of the brain that's generating the seizures is isolated. And we see that in the red versus, or in the pink there, versus the blue above. That certain parts of the brain that generate the seizures become more isolated, but there's a burst of synchronization, and the areas, the communication between different areas of the brain in many different frequencies becomes more rhythmic. And the goal of this paper is really to present a way for clinicians around the world to use our open source software to study not just events that occur in one specific area of the brain at the time of seizures, but also to look at how multiple different brain areas interact with each other around the time of seizures to gain more insight into how epilepsy is a network phenomenon rather than a phenomenon of an individual brain region. And this is an area of research that certainly we're interested in, but also many collaborators and colleagues around the world are interested in. And we hope that by presenting this toolbox to visualize these dynamics, we can advance certainly our research here, but also help many colleagues and collaborators advance their research in this field as well.
Alrighty, I'm sorry about my change of background. My internet was buffering in the other room, so I moved spots.
Problem at all.
I wanted to change gears a little bit and ask, based off of the current situation with the COVID-19 virus, what have you been doing during the quarantine?
So I've been reading a lot, and believe it or not, our research lab is actually more active than ever. So, you know, we used to have one meeting a week. Now we have 3 meetings a week. And we used to, you know, have one journal club. Now we have 2 journal clubs. So we're actually quite active. Like many people out there, we've needed to shift our focus away from you know, necessarily doing elective surgery. So much of our epilepsy practice has toned down during the COVID pandemic, but we're shifting our focus and our efforts and our energy towards other initiatives, primarily within our research lab. So we're still very, very busy.
One can imagine.
Well, I'm sure the audience will agree that this interview was fantastic, and we've all learned a great deal from you about not only how epilepsy is like a network phenomena, but so much about your personal experience as a neurosurgeon and how your research has impacted so many patients with drug-resistant epilepsy. Before we wrap the interview up, I just wanted to know, do you have anything else you want to share with the audience?
Well, I mean, it's very kind of you to ask. If anyone, you know, who's listening to this podcast, number one, has epilepsy, I want them to know that, you know, there is a community of people out there that is dedicated to treating epilepsy and to improving the lives of patients with epilepsy. And certainly they should speak with their doctor about the many, many options that are available to them. And every year, there are more and more discoveries that can potentially help them. So there's so much hope in the future for the treatment of epilepsy. If there's anyone out there who is a student or who is interested in neuroscience or neurosurgery or epilepsy research, I'd want to tell them that there has never been a more exciting time to pursue a career in the neurosciences, in epilepsy research, in neurosurgery. And you know, certainly if anyone out there is just affected by COVID and watching this video because they're at home and in social isolation, you know, we're all in the same boat, and this too shall pass, I promise.
Thank you so much.
Thank you. Yeah, thank you so much for those words, Dr. Ibrahim. So we'll continue reaching out to scientists and clinicians to increase the awareness of the significance and innovation of clinical neurophysiology and neurosurgery research. We just wanted to thank you again, and we hope you have a great rest of your week.
It's my pleasure. Thank you so much for having me, and thank you for highlighting this article. So it's a real pleasure.
No problem. The pleasure was ours.
It was.
Take care.